the Health Literacy and Child Health Networking session. What do you think, Andrew? Give it another couple minutes, do you think, or should we just?
We could just get started. I don't know. People will join as they join and they'll jump in.
Okay, sounds good. So hi, everybody. Welcome to the networking session for folks who are interested in child and family health. I'm Shauna Yin. I'm helping to co-facilitate this session with Andrea Morrison. I'll introduce myself real quick, and then Andrea, and then I'd love to, have all of you guys introduce yourselves as well. So I'm a general academic pediatrician. I'm an associate professor of pediatrics and population health at the NYU School of Medicine. And I do research looking at the intersection between child's health outcomes and health literacy and health disparities. And a lot of the work is focused on designing health literacy informed intervention strategies to ameliorate disparities, and that's centered in a lot of different areas, whether it's medication safety and thinking about doctor-patient communication and thinking about medication labeling as well, to chronic disease management, as well as obesity prevention. So excited to be here today talking with all of you. Andrea.
Hi, everyone. I'm Andrea Morrison. I'm from Children's Wisconsin and Medical College of Wisconsin in Milwaukee. Thankfully, it's not too cold here yet, but it will be soon, I have a feeling. So I am an emergency department physician at our Children's Hospital Emergency Department and have been working in health literacy for a lot of years, it feels like, with an emphasis looking at healthcare utilization, but also quality improvement in health literacy. And I was named medical director of health literacy in our quality department last year at our hospital, which was many years in the making, and direct our health literacy task force. So I will go around and have others introduce themselves, and I'll call you out because it always gets a bit confusing on Zoom. Shauna and I came up with a couple of questions that we would love people to think about as they're just talking about themselves, where they're from, what their interests are in health literacy, but also maybe what is the most exciting next step for you in your work or your biggest challenge, or what do you think are the next big issues facing the field of health literacy in the context of child and family health. I'll put those in the chat so you guys can think about them a little bit. As I was saying that, I realized I'm a visual learner, so I like to help other people that I know are visual learners too. So Kim, you're next on my screen. If you want to go ahead and introduce yourself, we'd love to hear.
Okay. Hi, I'm Kim Manning. I am a program coordinator and a health educator at Boston Children's Hospital and with the Region 1 Pediatric Environmental Health Specialty Unit, otherwise known as PACEU. And my biggest role with health literacy in our group is really that it's a form of environmental justice. And so, how are we able to communicate effectively and making sure that we are including those families that are most in need of our services? How are we reaching them and how are we communicating them and making sure that we don't just speak doctor speak all the time? And so that's been my self-appointed role, is to try to keep us on track and be thinking about these things. And I do think that the biggest obstacle is cost, where we're grant funded in a very small budget and a very small team. We don't really have the funds to do some of the projects that I've seen in this this conference. We don't have video specialists. Like we have one that we use when they're available. We don't have, so we're limited by funds to do the best work that we could be doing.
Thank you. I really appreciate that. I think very interesting work. We'll love to hear a little bit more about it, hopefully during the session too. Carol, will you introduce yourself?
Yeah, hi, my name is Carol Howe. I've been a pediatric nurse for, I think like over 30 years now. Worked as a clinical nurse specialist and a diabetes care and education specialist at Children's Hospital of Philadelphia for almost 20 years. I'm now in Texas. I got a PhD. I teach at Texas Christian University. So my health literacy work has gone from the clinical side to the research side. And I think the most exciting thing is that I now have research privileges at Children's Health in Dallas. And we're doing, with a partner, we're doing our dream project that we ever always wanted to do, which was to work on health literacy communication in ambulatory clinics. And clinics said they wanted to work with us. So that was the most exciting thing. But now that we're in it, it's proving to not be so easy. Especially the pandemic has made it really hard, right? So clinics are 2 years behind now, and their patients are now coming back, and they have a 2-year backlog because they weren't seen really, and they're short-staffed. So, that usual launching of a program and doing some education training, we don't have an hour, 30 minutes, 20 minutes with any providers. So we're developing actually micro lessons, and I've been doing lots of observations in the clinic to try and make that micro lesson really relevant to. So I'm using all my health literacy stuff that I used to do with patients. I'm trying to use it now with providers and staff. And Cliff Coleman gave me like such encouragement yesterday. He doesn't even know his 2 sentences yesterday made me think, okay, maybe this is on the right track to try and teach health literacy communications in 2 to 3 minute sound bites, right? And feedback. So that's that. And, working with kids, I think is easier than providers. So I'm not sure why I switched from working with the pediatric children and parents to the providers, but there it is.
I love that idea of micro lessons and how to fit it in, because I find the same on the ground, challenges in the clinical setting, trying to, promote adoption.
It might actually even just be as you're walking down the hall, right?
Yeah.
You just kind of.
Absolutely. Great.
Very true. I really like the line of it's easier to work with kids than providers. It's so true.
Oh.
Yeah, the work I've been doing improvement work at the hospital. That's 100% true. At least I have a group of my own docs that I can, work with, but it is a challenge.
I know, and see, I'm a nurse telling a doc, so it has all those.
Yeah, yeah.
It has-
No, there's a lot of
hierarchy things in there, and yeah.
Having roles talk to similar roles is really helpful.
Yeah.
Because there is that.
I'm working on some physician champions now. I'm
Good.
converting them.
Good. Kelly, will you share a little bit with us about who you are and what is going on in your health literacy journey?
Hi, everyone. My name's Kelly McLaughlin. I'm a health education specialist and a nurse in the Raleigh-Durham area in North Carolina. Let's see, what's the most exciting? I'm reading. What's the most exciting next step for you? So I work independently, doing training with health professionals, doctors, nurses, social workers, et cetera, around training them on providing care for transgender kids and their families. And I'm working right now, I've been working with Duke University's Center for Child and Adolescent Gender Care on looking at what tools we use to really accurately intake patients, pediatric patients, peds and teens, and make sure that all their needs are met and that they're accurately diagnosed. Because the US is really behind a lot of the rest of the world, at least parts of Europe, in trans care of kids, we've been focused on updating those tools. And as I'm participating in this conference, I'm realizing that I feel like I've let my colleagues down as the person holding the health education banner, by not championing literacy enough. I think we've focused so much on making the tool really inclusive. And by inclusive, I mean making sure that kids don't fall through the cracks, because as you might imagine, in the last 4 or 5 years in particular, there's been extra socio-political pressure around any or related to any care for transgender kids, as governments across, at the state and federal level, some people have been outraged over care of transgender kids. And so we focused on, making sure that that kids get as much as they need. And as I'm participating in the conference, I'm realizing like we just really need to go back and look at some of those tools and make sure that we are making the tools as accessible as they could be. So that was a very long-winded explanation, but that's where we are.
Thanks very much. And just so you guys know, I'm making a list of challenges because those might be some really good things to discuss. And for you, I put not championing health literacy enough in materials. I think that's a really important point, that sometimes we lose the forest for the trees. Chelsea, if you are able to turn on your camera or talk, let us know. I'm not sure if you're at a place where you can, but we'd love to hear from you.
Maybe she stepped away. Are you there, Chelsea?
Yeah, that's a good possibility. Okay. We'll see if we can get her if she comes back. I'm going to put the biggest challenges and the exciting in the chat. Although it looks like I accidentally typed a line twice there, but
I love that you're taking notes, Andrea.
what's that?
I said, I like that you're taking notes.
I'm a visual
great.
learner and I'm an ER doctor and easily distractible. So I always take notes.
And the Zoom recording will keep it for you forever.
Oh, good. Yep,
I'm
that's true.
pretty sure.
I'd love to hear a little bit more about, I mean, like, it seems like there's different target groups people are focusing on, whether it's parents or children or healthcare professionals, et cetera. I wonder if Kelly you might tell us a little bit more about the children that, and how old the children are that you're focusing on, and how are you thinking about approaching things once you're going back and the lessons that you learned?
The children who are seen at the clinic range in age from, the youngest is probably around 5 all the way through 18. As you might imagine, there were fewer kids in the younger cohorts, the 5 to 9-year-olds. Many more kids tend to present with the most severe gender dysphoria, and that's what leads them to the clinic. They present more around the preteen teenage years. Ask me your question one more time about.
You mentioned that you were thinking about relooking at all the tools that you've developed.
Yeah.
And it sounds like for the spectrum of ages, and sounds like maybe also with parents as well as with the children. So curious about your
it's challenging because there's really one tool, and who completes the tool depends on the age of the child. I say there's one tool. There are several, depending on which part of the intake process you're in, but it's either completed by the parent or by the teen if the teen is old enough and the parent is comfortable enough having the teen complete the tool. But I'm just realizing, I really think that we need to go back and look at making the tool more accessible. I think we have definitely tried to do that all along. I'll just share that I happen to also be a parent of a trans kid. And having years ago gone through that intake process myself, I can share that it's incredibly exhausting. I know that that's not my own personal perspective alone. It also, there's a parent advisory board that I happen to be a part of. And that was something that was echoed over and over again by other parents. And so when the team went to look at how do we do this intake process better, where we're both capturing data as well as making the process more user-friendly for parents, we tried to look at how do you make the process less long, but also how do you educate during that process? Parents often come in with so many questions and they're so overwhelmed. Sometimes the diagnosis, their child coming out to them is out of left field. Sometimes it's not, regardless of whether it's new information to the parent or not. The fact that they have been led to the point in time when they are now needing to seek medical care is usually a really big deal for them. And so so it's overwhelming. It's overwhelming. And when I say, we talk about educating them, there's so many new terms that lots of folks in the general public aren't aware of, like, what is cisgender? A lot of people haven't even heard that term before. And so we try to educate during that process. But now as I'm, thinking through the process with my health literacy hat on, I'm thinking, how do you balance that educating during that intake process while at the same time making sure that we're being sensitive to health literacy needs. Does that make sense?
Mm-hmm. Kelly, as you describe it, it reminds me a lot about a new diagnosis of diabetes. And Carol, I wonder if you could shed some light for her on what it really reminds me of, that because it's just that, out of left field, full of jargon terms, lots of new information. I bet you've got some great tips, Carol.
Yeah, it's an interesting thing. You're right. And I'm sorry, I was sort of just, I had to look up something that I have to deliver in 20 minutes. So I was sort of half listening. But in terms of that coming from left field and really thinking about, well, what can families absorb? Because I'm sure it's also parents having to absorb, right?
Oh, yeah.
And depending, my dissertation was really looking at how can parents' perception of education from diabetes educators. And then I sorted, it was a quality mixed methods, but I sorted it by those with adequate and those with lower health literacy, and really looking at, well, what's the how do they like to get information? So I really appreciate you saying you're a visual learner, but depending on the learner, I don't know what you do in transgender education, but a lot of it, you have to be giving information that people can manipulate or think about in a way that's not just conceptual. But I don't know. And I don't know whether the transgender community has made like telenovela, like novellas, like almost little stories that see themselves in. And I'm sure that would be if people have made them, right, to be effective. I'm sorry, Andrea, am I in the right path? Because I really realize I'm chairing a search committee like in a half an hour, and I was like, I am not together on that. So I had to look real quick.
No problem. Isn't it funny how virtual conferences in real time too, it's just you get pulled different ways.
It's terrible, right? I have to leave in 10 minutes to pull students to go somewhere and then be somewhere else. Yeah, and I should just be here all afternoon. No, I appreciate, I'm so curious, how much of when you're interacting with the families, is it talking with the kids versus the parents? And I helped start and run a diabetes camp for years. And we interestingly, we had I think she started when she was about 10. She would come to the med shed every single night and she'd be in tears, despondent, all that. Following year, she kind of started revealing to some of us that she really felt like she was a boy.
Mhm.
And so now it became, well, how are we, you need to talk to your parents, right? Like we know, but your family doesn't know. And so that became this whole thing. None of us had, this was years ago. We didn't have any experience with it. And now she is an incredibly happy ma'am, but she came back to diabetes camp as a boy, actually bound, not so no surgery, but bound and wanted to be in the boys' cabin. And everybody was like, oh, they're 12 years old. They're not going to be able to take it. So he was with the boys' cabin all day, but then slept in the girls' cabin. It's kind of goofy. And then, but by the next year, everybody forgot that, like the kids just kind of accepted him and he was all boy. But it took 2 years of camp to help him transition and help the whole world transition with him, really.
Mhm.
So that
Kelly,
was,
I have a question. Oh, I'm sorry.
no, please.
I have a question, as far as like, the cultural competency part of health literacy, I can think off my head certain cultures who would be very resistant to a transgender child. Does that occur before they get to you, or are you also needing to kind of consider that when you're educating, those families, maybe, Hispanic families, right, where there's a very machismo background, and I am generalizing and I fully am aware of that, but that hesitancy to be like, this isn't real, or this is, you know what I mean, like, or religious beliefs. Are you having to deal with that also and educate through that piece too?
Mhm. It happens before they get to clinic, and it happens during clinic, that with some families, and some providers as well, which is, which brings me to some of my passion for needing to educate providers, because there are so many providers out there who are still so ignorant about just some of the most basic aspects of trans care, and understanding that gender, even to the point of some providers not understanding that gender dysphoria is a very real thing, and that trans people are real and have existed for hundreds of years, probably thousands of years. So yes, we have to educate through all parts of the process. And not just because some parents are more ignorant about trans-related issues than others, but also because it's super normal for parents to have lots of questions as they proceed through the process with their child. They have lots of questions, but also lots of emotions, and so there's lots of education that has to happen around that also. Does that answer your question?
I was wondering about, one of Kim's comments about like resources and not having enough funding to do the things that you want to do. And I was curious about, like, I know a lot of within our sites, we're always like, I always find that we're often like developing our materials within each site, and everybody's pouring in resources, and it feels like it would be so amazing if we could all work together and have those resources shared across places. But I find that that's a huge gap. So I wondered, yeah, like in terms of like developing materials, have you been trying to collaborate across sites to kind of share those resources so that we can do those projects, those green projects and other, that we've always wanted to do?
Yeah, I think recently we created, so it was me from Region 1 of the PACU, and someone, I think another region, plus the national office with funds from the American Academy of Pediatrics, and we did a COVID comic strips. I don't know if you can see them here. So we did these we turned them into stickers and coloring books and posters. And so that was great because because we did it in collaboration with the national office. They funded the project. They funded to have a designer. They funded to have, all of that. But on our own, when we're doing something local, we don't have that. So, we had to trying to get resources to translate materials. And that's been I think the biggest issue for me is that like even at Children's Hospital, the portal was only in English. So until recently, I think it's part of it, and Zoom isn't always in another language. And so locally, using our Children's Hospital resources, they're trying to get better. But a lot of our patients don't speak English, and so then there's access issues because they can't understand the emails they're getting. They can't understand the directions once they get on the portal, once they get on Zoom. And so they can't even access the translator. They can't even get through that door. So it's, but yet we're stunted because that infrastructure is out of our hands. And so, and even so, like, we have these materials we're trying to get translated. It's like, okay, we have this like $300 budget. I can get one document translated, or I can get a couple, and then that's it. Because, like, I can't use my daughter who's fluent in Spanish. I have to use their translators, and they're hugely expensive. So now it's like, we have one or two things that gets translated a year. And it's a step, but that's, I think, it's been a frustration of mine that at this point, this should not be this difficult. So to get done.
I don't know whether, at least in Texas, I've had really easy access to the local national networks of Library of Medicine. And they have funded like different intervention programs. So it's not really funding for research, but it's funding, like, we made a Weblit legit, like, teaching teens to tell reliable from the unreliable health information. And they funded us to be able to run focus groups with kids and to create materials. And then it becomes part of the NNLM's group. They helped us, they supported us to make a health literacy workforce training toolkit that's now on the CDC site. So it's not big monies, but it's exactly what you're talking about. There's also, like, sometimes you can ask for monies to hold a little conference, and I'd tell you, go look, and it's by region.
Okay.
So you can look at, well, what are they trying to highlight, and then just frame your project just from their angle a little bit.
Yeah.
And
that's great.
And get to know the program officer who's in your region. And they're very supportive of projects. They want them out there in the community. Mm-hmm.
Oh, great. Thank you. I really appreciate that.
Mm-hmm.
Yeah, I hadn't heard of that either. So that sounds like a great place.
No, I shouldn't have told you guys about it, but we're in different regions.
We won't compete, don't worry.
They're in totally different regions, but it's not like an NIH grant application. It's not as expensive. And you should know, if you apply, they really want somewhere in there that you really are supporting Medline Plus, because that's an NNLM site, all their education materials. So somehow angle and show that you can incorporate them in or add to them, right? So the transgender stuff, like, you could possibly add to them.
Shauna, I know I've heard you talk about this before, like having a repository of information. I think it's a really great idea. The IHA did do that for COVID information. I don't know if you guys have looked at that at all, but I think I uploaded what I wrote for our hospital, but the challenge was kind of like sorting through it. We got everyone to upload it, and there were like 300 documents or something like that, which is great, but it made it a little bit of a challenge. Maybe this is a challenge we could take to IHA, that they could support some document repository and have it in a system
first. Make big
yeah
buckets.
Yeah,
Create the folders for them.
Yeah, I thought they were going to try to go beyond COVID, but I don't know how that turned out.
I haven't
Just
seen
over-
it.
What was that? Chaos?
I said, no, I haven't seen. I haven't
Oh, you
seen
haven't
it.
seen it?
No, I haven't looked for it other than the COVID one.
Yeah. Chelsea, I see you're there. Do you want to introduce yourself? Because I know you had said you were jumping between some different.
Hi,
Yeah,
Carol.
sure. I was kind of jumping from the different networking sessions because it's hard to just pick one. But yeah, I mean, I have a few. Oh, sorry, backing up a little bit. So I'm the community engagement manager at Kaiser Family Foundation. A lot of groups have kind of highlighted KFF's research, which is what's really cool. Always nice to see. We are a large entity though, so the team that I sit on is the social impact media team, and we design media campaigns, communication-based campaigns, which is why I'm here presenting, as presenting earlier, but based on the research that KFF does. So I personally don't do the research, but the team that I work with and approximate teams do that research. So I did tell another group this, but I was hoping to see a little bit more reflection, I think, on some of the stuff that we're seeing right now, like these and really unfortunate health inequities and disparities in our communities. I don't think I saw too many presentations that focused in on that. And I do think that this was a great opportunity to kind of highlight that. I saw a few that addressed different types of disparities, but not a lot that addressed race specifically or ethnicity. And so it's hard because I think we're in a really good position right now to address these things. And so I hope to see a little bit more of that maybe next year, or maybe there needs to be a committee, honestly, in IHA to kind of identify the importance of race and ethnicity in health literacy. Because I don't have all the research in front of me right now, but there are definitely connections, and I was hoping to see a little bit more examples of that, but that's just my 2 cents.
I think that's a great, interesting topic. I hope everyone got to see the opening session today. I thought that was such a fantastic session, and I was going to try to bring up there was one quote that came from the article about health literacy and power, and that was really impactful to me, that as the health institution or healthcare organizations, as the individuals in power, we should be empowering the individuals that we serve with health information, and we shouldn't just be keeping it for ourselves, I guess, essentially. I can't remember the exact quote. Shauna, you were on that article I saw. But I thought he did such a wonderful job. But it's interesting that you bring it up, that maybe within the presentations and the research that people haven't focused on that as heavily.
Yeah. I did attend that presentation. I thought that was a really great example. I think what I'm identifying is within the presentations, like outside of the keynote, because that was incredible. And I actually went to Northwestern for my master's in health communication, so that was cool to see that. I think that's why I'm going back to, like, maybe there needs to be a work group or something that helps identify, like, within all these research presentations, which one are directly addressing, like, something, race, ethnicity, how that's connected to health literacy. Because if we're looking at the scope and all the different things that were brought up, I think I counted someone say race like maybe 15 times in between both days. And I do think it's a really important factor in someone's ability to listen to a message. If that messenger does not look like them, in some communities, that's a major deterrent to even hearing someone out. And so we're not there, and if we can't identify that, then we have a long way to go. I look forward to doing more of these presentations. I personally, I have a master's, but I'm working towards a doctorate, hopefully in the coming years, because I'm very, interested and invested in this work. And it's good to be in company with folks who are invested and interested in this work. And at the same time, recognizing that we do have some work to do.
Yeah, absolutely. I mean, I think there's been some research looking at health literacy as a mediator of health disparities and health outcomes. and much fewer research. And there aren't that many, but there's been some. And then I think the next step is, what do we do about it? And I think that's super challenging, is how can we, design interventions or identify strategies that can try to ameliorate those disparities. And I mean, I feel like that area of research is really like wide open in thinking about how to best do those things. So I am hoping there will be more research along those lines.
I will say that I think it's really important that equity has become such an important part of at least, healthcare organizations and other organizations. And I do think that, organizations are trying, and honestly, we're selling our health literacy work at our hospital as equity work, and as part of our health equity work, because it is, and it's, giving everybody information they can understand, is, the way we can create equitable outcomes, or a way that we can do it. It's, it's part of the whole picture. So I think that's, everyone and all the work that I'm hearing this group working on, can continue to try to strive for creating that equity. So, but the importance also is in measuring it and making sure that we are attaining that actual goal. We only have 3 minutes left. I guess we only have 3 minutes left.
Really? Wow, I thought this
Going
ended at
fast.
2:30. But yeah, I know Kim earlier mentioned the health literacy as like a social justice like kind of issue, and I feel like that's yeah, framing it in that way. It's been, I think it's being increasingly done, and yeah, I think, but I think yeah, more research is needed for sure.
Yeah, and I think for us, we're also realizing that we're so heavily, white in Boston and Children's Hospital, that we actually, one of the PSU's goals or missions is to create a pipeline for other groups to come in. So making sure that we have like internships and we're educating at the high school level and the college level to give those opportunities to get other communities an opportunity to participate in all of this and in environmental justice or in that work, so that it's not just somebody that looks like me out there doing this. Like we need we need everybody to kind of come together and have an opportunity to collaborate on this. And so that's one of the things that we're really trying to do to help, just to help improve all of it.
Yeah, and I know this is just a networking session, but there are, I don't know, Andrea, if you want to talk about ILA, and they have special interest groups and such that could be working throughout the year on, and there may be one on equity. Is there one on disparities?
That's a great question.
I'm not actually 100% sure. I can look while you're chatting.
Yeah.
But,
So
Andrea's, been really involved in some of it.
So just to make everyone aware of I'm not sure if everyone is aware of ILA, the International Health Literacy Association. So there are groups within ILA, and one of them is the Child and Family Health Group, and it's ran by Sasha Fleury. And then Shauna is actually co-chair of one of the research group, which is a lot more active, I think, than the Child and Family Group. But hopefully the idea over time, with these subgroups, is that we can create an active community, and I think it's just going to take some time for that to happen. But certainly, if there are a group of individuals that want to work on something, I think ILA can at least create some of the infrastructure for that potentially. So ILA just had its inaugural conference this last month. Unfortunately, it was supposed to be in Taiwan and ended up being virtual, but maybe again will be some different venue, which would be really fun to travel to. But also just for others, awareness, because I'm not sure if everybody here knows about. So number one, the IHA has a listserv. Do you guys all know about the IHA listserv? So you can sign up at IHA.org. Let me double check that, but I think it's IHA.org. And nope, it's not. let me see. I'll try to find that link for you guys. So the listserv is a community, an active community of people you can ask questions to. It's not just child and family though. This is all individuals involved in health literacy. And if you put something out there, you're going to get some answers back. So definitely it's a great venue to put some information out there and get some answers back. The IHA is an organization that also has a conference in the spring, usually in May or June. And last year was virtual, but maybe we'll be back in person. It is in California, which was always fun to go to as well. And I'm not sure that it applies to anyone here. Shauna and I are part of the Academic Pediatric Association. So it's mainly doctors, some psychologists, and there is a health literacy SIG within that group. So it's in a pediatric organization, and we have a health literacy SIG. So that's one other kind of child and family health literacy piece out there, because it's really nice to have individuals that are like-minded. And I do find that I find it more helpful to sometimes talk to my pediatric colleagues, because the pediatric colleagues are the ones that really, understand and get what, I'm working on. I put a link in there, and you'll find on that IHA page is at the top right-hand corner, there is a join the health literacy discussion, and that'll sign you up. You just have to sign up for a free account. And by the way, ILA, which Shauna added in there, is also free to sign up for still, right? There still is not any membership dues at all.
And there is a health literacy and health equity SIG. So that
good.
if you're interested in working on health disparities and such, that might be a great one to join. I have not been to that one yet.
I have a question. I think Shauna, maybe it was you that mentioned it about the group under the health, maybe it was ILA, but it was it sounded like educating physicians or they had a group. You had mentioned that there was a group for child and family health, but then there was also a group that was mostly physicians, but it sounded like, was it educating physicians?
So the group that I mentioned, so the Academic Pediatric Association is made up of, hey, Marianne, of mainly physicians, and there is a health literacy SIG within that group. It isn't necessarily in particular driven towards educating physicians, but they actually, bye Chelsea, thanks for stopping by. We do have some work groups, including research, so research in pediatric health and health literacy. There is a group a little work group focusing on educating physicians, and right now we're working on a program for residency programs. And then there is a kind of group of organizational people interested in organizational health literacy. So but you do have to be part of the APA, the Academic Pediatric Association, to be in those kind of work groups.
Okay.
But that's I think what we were talking about as far as educating physicians. And
okay, yeah, we do a lot. We do create platforms and basically education materials for pediatricians. And so I've got these doctors who are all talking. I'm trying to say, well, not all doctors are English, they come with second language. We need to remember that, so but it's good to know that it's there. If I can get somebody to go join.
Oh, absolutely.
Perspective.
Yeah, I mean, and Kim, if you want to talk offline about it too, I might be happy to point you in the right direction or to someone, but that could maybe help out with what you're looking for. I'll put my email in the chat. Go ahead and email me.
Yeah, and I can put mine too if anybody wants to reach out to me. And Marianne, do you want to introduce yourself to the group? And there's one other person, Gigi, if you want to say anything. I know we only have a few minutes, but it'd be great to.
Hi, I'm Marianne Abrams. I'm a pediatrician at Nationwide Children's Hospital and the Ohio State University College of Medicine in Columbus, Ohio. And I've been working in health literacy for quite some time, and at Children's, obviously, I'm trying to affect organizational health literacy change. And I was in the other session about measuring health literacy. I was hoping to get some insights on measuring organizational health literacy, but they were very much focused on individual, which is fine. So I was trying to clone myself and be in both places at once. So good to see those I know, and nice to see those that are new to me, at least. Thanks.
Hey everyone, I'm sorry, of course I jumped in late and you can see my blue background, which was something else, another Zoom thing that I just came from. My name is Gigi Holder. I'm actually here in Jackson, Mississippi. I'm with the University of Mississippi Medical Center. I am a program director of a mental health grant for kids. It actually puts providers throughout the state in touch with mental health specialists so that they can talk about the mental health concerns of their patients. So that's one of the things I do, but when it comes to health literacy, I mean, that's actually kind of like a passion project and topic of mine. Not a lot of formal experience in the area. It's more so just kind of like, if I will, like kind of getting my feet wet and just trying to see in what ways that I would like to be more involved. Thank you, Andrea, for the information that you supplied about ILA and all that. I'm already on the website and would like to reach out to some of the groups and to see where I can possibly get more information about. But I think one thing for my own self is that I know that because I actually did do a postgraduate fellowship project regarding health literacy and looking at statewide task force, health literacy task force, that not every state has one. And I know here in Mississippi, they do not, but I was looking at surrounding states and even some like northern states that have those and just trying to look at like the effectiveness of those utilization. I don't know, based on where everyone else is, if you know that in your own locations, if there are those, how are those being utilized and like the effectiveness of this, but that's actually something that I would be pretty interested to know about for sure.
Interesting. Thanks for introducing yourself, Gigi. I'm actually in Wisconsin, and we have a health literacy Wisconsin group that actually is a subgroup of our literacy organization. So they kind of first developed as a literacy organization and then developed the health literacy kind of sub part of it. And they actually mainly work on grant funding and grant funded projects and have been working on a large pharmacy and medication project. The one thing I have to say that I'm really proud of them is they advocated with EPIC, which is an EHR that is home is in Wisconsin, to make some changes to how medications are written, at least how they're written and what the universal medication schedule directions. It's not perfect, but it's a start. So they've been able to do things like that, but it's been around for a long time. I'm pretty sure at least 15 years, probably.
When you say task force, Gigi, do you mean like an official task, like in Wisconsin, is it like a state-led task force, or is it kind of organic and grows out of like literacy organization or something like that? I'm just curious what you mean by task force.
Yeah, and Andrea, if you want to speak more to that, because I know that in some states, like you said, it has been either either grant funded or something where it's actually a project that has that sustainability piece to it, and it's actually meant to put on these projects or initiative, like statewide. It's not, like you said, not just a small group that's coming. It can start out like that, but ones that seem like they are in whatever way, not mandated by their states, but there's something there where it has more of a permanent presence.
I think, ours is more of a coalition. I think there's a lot of states that are more of a coalition. I could be wrong, but it seems like
you may want to go check into it and see what is going on in New York. I feel like we're very kind of diffused. I don't know if there's like a set task force, but
doesn't CDC have a map? Last time I looked on their website, that has states with health literacy coalitions. Now, last time I looked was a while ago, and it's still, I think, even might have had Iowa on there as being active, and it was active. I don't believe it's still active, but that's another place to look on And Ohio has I would say it's more like a coalition, like Andrea said. I'm not, and they have a conference every other year, I think, and do a little bit of advocacy. So for what that's worth.
Yeah, thank you, Marianne, for that reminds me, yes, I have looked at that before. It's like, you're right, yeah, it's a good list. It's definitely not like too extensive. Not every state has one. But it's a good place, like you said, to start to know who has what out there and where they are in their just activity wise of what they do. I know that some have conferences, so that's good to know for sure.
Arkansas, I think Jennifer DeHalla, I led that one for quite some time. I assume they're still pretty active. And for some reason, I want to say Nebraska, but I also know that we're over time, right? Whoever's on.
Yeah, I
tonight.
guess
We gotta
so.
wrap it up, but this is fantastic. It's been a great.
I
fun
did post
discussion.
I did post that link, Gigi, that Marianne was talking about from CDC. I just found it.
Great,
Yeah.
thanks, Andrea.
Wonderful.
Good to
Thanks,
see
Marianne.
everyone.
Good to see everyone. Thank you.
Thank
Good
you.
to see
Bye.
everyone.
Bye.
Nice to meet some new faces.
Yeah.
Nice to meet you all.
Feel free to
Take care.
email us.